Today, I'm going to focus first on how to lower your blood pressure by 20 millimeter mercury naturally. High blood pressure is a major global health challenge. We are adopting a from the Indian subcontinent, Africa, these people, now we are adopting a Western style lifestyle. Physically inactive, eating processed food, calorie-dense fatty food, high sodium intake, also excessive level of stress. It is well recognized that blood pressure can harm the body at microscopic level. The course of time leading to stroke, heart attack, kidney failure, and so on. Therefore, there is a great emphasis on reducing the high blood pressure number by lifestyle and medication. But when you go to doctor, for them it simply is to give you medicine simply brings the number down, but they don't do much to underline the process, why it's happening. They give you the medicine to lower your blood pressure, does go down, just a number, but doesn't actually fix your symptoms. Whenever you stop taking the medicine, the blood pressure rises again. Where the lifestyle, on the other hand, makes you healthier person, therefore may help to tackle the underlying process by doing so much, so also may reduce the number as well. But modern management system focus on easy fix by giving patient medicine rather than focusing on lifestyle management. Lifestyle changes for high blood pressure. Now, let's talk about that. What's the first thing which helps to raise your blood pressure? Can somebody say? We talked about this morning. Unmute yourself. Somebody can tell me.
Is the weight? Overweight?
That's right. Obesity.
Obesity.
That's it. Excess weight contributes to high blood pressure, virtually all forms of cardiovascular disease. Patients with body mass index of more than 30, more than double the risk of hypertension, which is worst form of blood pressure, which does not respond to treatment and causes more harm like inflammation, sympathetic activity increases, reduced nitric oxide level, even physical compression of the kidney due to lipid fat around the organ, and overall body starts not function properly. Every kilogram of weight you shed, your systolic blood pressure will drop 1 millimeter of mercury. To say, that's why my blood pressure went down as well. I lost 17 kg. So that means 17 millimeter of mercury of blood pressure went down, the top one. So that shows how important the weight loss is. But more, you have to make sure, try to have your body fat percentage. Shape of your body is very important. But most Asian people, when they put on weight, it's around the belly. So you have to reduce that to make sure not just the body mass index, but make sure your shape is proper, no ring around your stomach. So do all the exercise to get rid of your stomach kind of area. So obesity. So how do you know you're obese? Can somebody tell me? How do you know you are obese?
Your weight, height.
BMI, body mass index, you take your weight in kilogram, height in meter. If weight was 65, height was 1.65, you divide 65 by 1.65 times 1.65, which is 22.5. Under 18, you're underweight. 18 to 25, you're good. Over 25, you're obese. And we're over 30, very, very obese, and so on. What else can you do? What's the simplest way of doing it? you're fat or not?
Exercise.
No. How do you know you're fat? First, you have to admit to yourself you're fat.
Less energy.
No. That's okay. But how do you know you're fat? Pinch test.
Oh,
You pinch
you
more
can
than an
pinch
inch.
your, yeah,
Pinch
pinch
more
your
than an
hip.
inch, you're fat.
Yeah.
And then you measure your hip and your waist. For female, it should be 0.8, and for male, it should be 1. If it's more than that, you have to lose weight. The simplest way, take a piece of string, measure your height from your toe to the head, fold them in half, and put around your waistline. If you can't complete the circle, you have to lose weight. Simple as that.
That's very clever.
It's not me. I've got that from somewhere else. I'm just telling you, that's the part. I tried it, does work. So it's very good. So really, first you have to admit that you have to lose weight. And then you have to put a lot of action. It's like doesn't matter what yoga you do, what exercise you do. End of the day, if you eat 100 calories and you only burn 50 calories, then your weight will increase. So really, you have to burn more energy than you eat. That's what you have to watch. Balance the thing out. If I eat 100 calories and burn 150 calories, then I'm going to lose weight. That's the bottom. That's mathematics, simple arithmetic. You can't get away from that. So very first thing is, but not all of us have to lose weight. You still have the blood pressure. But one of the first way to lose your blood pressure down, systolic pressure, is by reducing your weight to bring your BMI to 30, 25 or less. Now, next is a very important one is the diet. Adults should not eat more than 6 grams of salt a day, which is about 2.4 grams sodium. That's around 1 TSP, 1 teaspoon per person per day, not per meal, per day. Average salt intake just now in the UK is 3.4 grams per day.
Wow.
So if you cut out the salt intake to less than 1.5 grams per day, every 1 gram less salt you reduce, your blood pressure will go down by 5 millimeters of mercury. How simple is that? So whatever salt you're taking, if you reduce that salt by a certain amount, then if you reduce 1 gram of salt per day per person, you reduce your blood pressure by 5 millimeters of mercury. Is that not a good thing? Excellent, isn't it? Next is, similarly, if you increase the amount of, what's the next mineral you should take to lower your blood pressure? Come on, somebody must know.
What? Magnesium? No.
You're getting there. Potassium. Potassium.
Potassium. Okay. Yeah.
Potassium.
Potassium.
Potassium. That is good for blood pressure. Average intake is 1.7 to 1.8 gram per day. That's what we take daily. But recommended dosage is how much? 4.7 gram per day. So if we aim to increase our potassium intake through diet to 3.5 to 5 milligram per day, then we can see an average reduction of systolic blood pressure by 5 millimeters of mercury per day as well. See how important? So eat a banana a day. Banana में potassium है. Avocado. All this, anything will Google it. Anything with potassium, take more of it. So you have to have a diet which recommends low in sodium and high in potassium.
Fiber. Potassium.
That's right. Low in sodium, high in potassium.
Potassium.
That itself will reduce your mercury, 10 millimeters of mercury blood pressure, top one down. Very, very important. And in medical science, they call it a DASH diet, which is designed to reduce high blood pressure, rich in fiber, fruit, vegetable, lean protein, less salt, less sugar, less fat, and less fizzy drink. These are the kind of diet, is the DASH diet. By this diet, you can lower your blood pressure by 11 millimeters of mercury per day. 11 unit will go down. So strong. So avoid eating animal protein, replace it by vegetable protein. Very important. Avoid refined carbohydrate, processed food, sugary sweet, soft drink. You have to avoid them. All these changes can make a huge impact on your overall health. Very important. Then you combine this with, somebody said beforehand, magnesium. Remember we talked about it? I'm taking magnesium tablet daily myself. What happens is when heart is pumping, when it's going, relaxing it needs some magnesium to do that, and calcium to contract. So they both play an important part. So you need to eat magnesium. That itself lower the blood pressure by about 1 unit, 1 to 2 millimeter of mercury, depending on if you take the right amount of magnesium daily. Next is omega-3 fatty acid. Then that will reduce your blood pressure by further 4 millimeter of mercury, just by taking omega-3. How important it is. And obviously, if you're taking alcohol, a certain thing, if you reduce to 1 glass per day, your blood pressure will go down by further 4 millimeter of mercury as well. Last but not the least, obviously, you're doing it daily. Yoga, meditation is the best way to reduce your blood pressure. Also, all kind of chronic disease, helps with the stress relief. Do low intensity activity like walking, pranayam, light exercise, swimming, cycling, and so on. At least 150 minutes over a week, you can bring your blood pressure down by 4 to 5 units. So remember, if you do all these activities, you're almost able to reduce your top blood pressure, high one, by 20 millimeter of mercury per day. So if you have a blood pressure, you're taking medicine, no problem. Take the medicine, but try to change your diet. And next time when you feel hypo, go to doctor, make appointment. He will check your blood pressure and might monitor for a few times. Or if you have a blood pressure machine, you record it yourself, give it to the GP. And if you see you're going low all the time, then he will reduce your medication. But let the GP be in control all the time. Any question on that so far? What I've talked about?
No.
Also, there's a lot of people with low blood pressure as well. Anybody got low blood pressure here?
No.
Anybody got low blood pressure?
No.
Yes, I had low blood pressure before, but it's fine now.
But I'll tell you how does the low blood pressure work now. Low blood pressure usually happens because you don't have enough blood in your body to go down the whole organ. That's what low blood pressure, my way of thinking it is. What is blood made up of? More than 90% water.
Water.
So that's why dehydration plays a big part in low blood pressure. That's why when you go to hospital with low blood pressure, first thing they do is put the IV and put the fluid in your body.
Saline fluid, yes.
Right, to increase your blood content volume so your blood pressure goes back to normal. Follow me? So dehydration can sometimes cause blood pressure to drop. And also it could cause by fever, vomiting, severe diarrhea, all this, anything diuretic, all this will cause your blood pressure to go down. What is the symptom of low blood pressure? Blood vision, confusion, depression, and again your fatigue, feeling cold, dehydration, feeling thirsty, you can't concentrate, rapid, and your breathing goes faster, and you sweat a lot. What is the cause of low blood pressure? if you're lying in bed for too long, when you rest, your blood pressure does drop automatically. That's why people with high blood pressure, when you press the heart point, if it's paining, that tells me you have to take a rest for 3-4 hours. Just lie on the sofa, on bed, with the leg up completely, gently breathing in, like a savasana, going into the state of parasympathetic nerve system to relax the whole body. Very important. And then certain meditation, certain medicine will cause low blood pressure as well. Like sometimes some people are taking diuretic tablet for hypertension, beta blocker, drug for Parkinson, and so on. And also, if you have a hypothyroidism, that lowers the blood pressure as well. That's why in Nepal, people who live in the high mountain, they tend to have more low blood pressure, and they also have a hypothyroid problem as well. It's all part of the relation of where you stay, which part of the country you're sitting as well. And also, sometimes if you have severe infection, that can cause also your blood pressure to drop as well, or the allergic reaction. A lot of people have the anemic or lack of B12. That will not produce enough blood, and that will give you low blood pressure as well. And that also lends to travel sickness. When you travel in the car, you feel vomiting, sickness. That's what happens. It's all part of the connection altogether. B12 and folic acid, they play an important part, which cause you anemic and lead to low blood pressure. So how do you raise your low blood pressure? Any suggestion, Linaji? Since you had low blood pressure, how do you manage to recruit your problem?
Maybe intake of salt more.
That's right. That's very excellent. Well done. What else? Why do you take salt? The salt absorbs more water, so make sure drink plenty water. That's what the French say.
Yes.
People with low blood pressure drink plenty water, then that won't happen. Obviously, eating more salt.
But putting your head down.
Yes.
That may help. Also, what happens when people eat too much, overeating, then your body goes into sympathetic nerve system. So that gives the lowers the blood pressure. There's no enough blood left to go for the organs. So that's why people with low blood pressure should eat a small meal more often. So that's why people with low blood pressure should eat a smaller meal, smaller portion more often rather than big meal. If you eat a big meal, that will drop your blood pressure as well. Any other thing can lower your blood to raise your blood pressure?
Maybe movement, active, you to be active a little bit so that the blood moves.
That's it. No, but thing is, remember, you have to produce the blood. So you're obviously drinking more water, eating all the right thing, right? But you're not anemic, and also you're not lack of B12. All these will help. So your spleen is producing more white blood cell, red blood cell, and also the WBC for fighting infection and so on. So to raise low blood pressure, drink plenty of water, eat balanced diet, vitamin B12, folic acid, iron, so you're not anemic, and eat a smaller meal, and eating certain food that can help to raise your blood pressure as well. Try to consume more fluid to prevent dehydration, and so on. And obviously, you said that salt, plenty salt, you have to eat more salt if you have low blood pressure. And also your sugar level, check your sugar level as well, normally. That's more or less kind of. All of you are there. Somebody come now. Give me some more hint. Even high blood pressure now. How do you? Any other suggestion you have for high blood pressure? What to do?
Have a lot of water, plenty of water.
Yes,
try
that
to
helps in every case. Yes,
lose your weight.
definitely. One
More
thing I find,
Exercise.
Take less
Arthur,
salt.
what's that?
Take less salt.
Less salt.
Yeah. If you have a high blood pressure just now, for argument's sake, or low blood, doesn't matter. Then all you do is, if you look at your feet, also turn it and see whether
If it's swollen,
where you have
it's
the
swollen, then
where
it's
you have the big bubble to press that point.
Yeah,
If you
yeah.
press it, your blood pressure will go back to normal.
Can't see it.
It's like a first aid.
Can't see.
And see you, Sarvanji.
I can.
Let me look at that. Hold on. Let me highlight. I didn't highlight it. Sorry.
Better.
Can you,
No.
is that a point that you, Servanti, is that the point that you,
Also,
is that
let me
the
just-
point that you, is that the point that you're supposed to put, put the acupressure on?
just there.
Is that the point in the book as well? Yeah.
No, it's not in the book. But that's the diaphragm. They're pressing it. You squeeze the lung, so everything blows out and clears the whole blockage. Whatever causing your blood pressure to go down. So blood goes back to where it's supposed to go, to right places. So what you do is the easiest way is to put a marble on the floor and put a stand on it and just go like this. Just turn around on the marble. And your blood pressure will go back. It's like a first aid. A quick healing yourself.
Sarvanji, can we put the electric pan on it? On the
Yeah.
point?
It's the same way you can put electric pen as well. That's what I'm thinking. But I was telling you, that's why I just put this across there. The thing is, the skin is very thick. It doesn't make much difference. It takes longer. Because hardly I can hardly feel anything there. Because skin is too thick.
Oh, okay.
Follow me. So it doesn't really make a thing across. It doesn't really make a difference.
Okay.
The best way is actually to press it. That's why I was saying to you, every morning in summer, try to walk in the grass. Morning, that's walking itself will help you manage your blood pressure better every morning.
Okay.
Well, tell me more of the Dadi ka nuksa kya tha? What your grandmother used to tell you to do. Trifla powder. Take 1 teaspoon of trifla powder.
Yes.
Which contains amla, harad, and veda in powder form. That helps to lower your blood pressure, help you to manage your blood pressure better as well.
So do we have to take trifla when we go to sleep or in the morning?
No, in the morning and night time as well. This also helps to clean your stomach as well. Because most illness happens due to here. If you have too much gas, that's what gives you palpitation and gives you high blood pressure and so on. So once your stomach is clear, good bowel movement, trifla is like a tridosa. Vayu, Pitta and Kapha. Through may help to balance that.
Does it help with constipation, that means?
Yes, that's what people use it for. But I wouldn't recommend to take it all the time. You take it for a couple of weeks and don't take it for a couple of weeks, then you start again. Hit and miss. Don't depend on it too much. Otherwise, your contraction of large intestine will stop. You don't want that. Try to eat more fiber, insoluble fiber. That will help.
Julag, follow off the big ball.
Anything else? So how many talk about?
Reduce salt. You have to cut down on white stuff, which is salt, sugar, and menda.
That's right. Anything white also for
All the S, white, S, white stuff.
Yeah. That's for overall health. Even for people with people with cancer, don't give them anything white, like white rice, so white is no wheat. देते हैं बाजरा का रोटी खिलाते हैं, बाजरा का रोटी, सिंगारा का रोटी.
Bajra.
Yeah, उससे health के लिए अच्छा है.
Juar, bajre, makkei.
One of the best things Swamiji does with dalia, make your own dalia and eat that. That's very good for diabetes as well and for blood pressure, everything. Because it helps to clean your bowel movement better.
Yes.
श्रमण जी,
Yeah.
श्रमण जी, वो ट्रिफला कब लेना है, सुबह या रात को?
हम तो बोलेंगे रात को लेंगे तो सुबह सब पेट साफ होगा ठीक से.
तो रात को ले
ले सकते हैं।
रात को बेटर है ना
हाँ,
लेना?
हमारे ख्याल से पर सुबह लोग कितने लोग सुबह भी लेते हैं, कितने रात को भी लेते हैं. Just depend what works for you, you know. And also another good thing to take is, if you're not diabetes, and after you move your bowel, go and have a glass of beetroot juice.
Okay.
Beetroot got so much enzyme, you have to go to bathroom again within 20 minutes. It cleans all the sludge. It cleans all the sludge from your stomach. I'm a plumber. See what happens when the नाला जब block हो जाता है, आपका घर का नाला जब बंद हो जाता है, पानी नहीं बहता है, तो प्लम्बर आता है, वो क्या करता है, वहां पे रंग डालता है. अब उधर देखता है कि वहां रंग निकला है कि नहीं निकला है, तो वहां ब्लॉकेज है. देन वहां पे पाइप डाल के साफ करने की कोशिश करता है. उसी तरह आप जब बीटरूट का जूस पीते हैं, विदिन 24 आवर आपके पेशाब में जब रंग निकलता है या टॉयलेट में, वो निकलना बंद होना चाहिए. नहीं बंद होता है, इसके में आपको IBS है, आपको सर्टन आपकी colon में सर्टन ब्लॉकेज है.
Thank you.
It's such a simple way of, you know, diagnosing your own illness.
Your own illness.
And beetroot juice is very good for people with constipation all that. It cleans the whole sludge in the body. Even green juice, any kind of green juice at all.
Yeah, green juice, wheat juice.
Wheat grass as well, yes. Because
yeah, I've got wheat grass. Yeah.
because what they do, I live with people with cancer. I've learned to. I spent some time with people with cancer. They had 7 trees of wheat grass growing. They used to cut Monday, Tuesday, Wednesday like this, and juice it and take that with mix with other juice and drink it daily, kind of. But you can buy powder as well, wheat grass powder. You can mix it with any kind of juice and drink it.
Amla is very effective.
What's that?
Amla, you know, Indian gooseberry.
Amla again, it's got a lot of vitamin C.
Yeah,
Amla's got a lot of Indian gooseberry.
Yeah, but it makes you go as well.
Yeah. Good for also your bowel movement as well, you know, gives you good for eyesight, good for a lot of things, you know. And it also helps to absorb iron. If you're anemic, Amla will help you to absorb more iron in your body so you don't become anemic. So your blood count will increase automatically.
तो श्रवण जी, हम है ना शाम को रात को सोने से पहले हॉट वाटर पीते हैं, तो वो है ना आपको वो पेट के लिए भी बहुत अच्छा है.
हॉट वाटर,
गर्म पानी, हाँ पीना.
हाँ, गर्म पानी पीने से फायदा होता है रात जब भी पिए, पर ठंडा पीने से भी दोनों का फायदा है. गर्म पानी पीने से पेट साफ होता है. ठंडा पीने से क्या होता है कि आपका एनर्जी और बर्न होता है. पहले बॉडी को पानी को हीट करना पड़ेगा तब डाइजेस्ट होता है, तो दैट बर्न्स मोर एनर्जी एज वेल. तो दोनों चीज का फायदा है अलग अलग. ठंडा पानी का भी फायदा है, गर्म पानी का भी फायदा, डिपेंडिंग व्हाट यू वांट टू अचीव, है ना. It's just a general discussion. Anything else you want to talk about? I'm happy. You still got 5 minutes left, something like that.
You said celery juice. What's that?
Celery juice,
good
very
for?
good. Yes.
Nitric.
What's that good for?
For bone, also create nitric oxide, which helps to reduce your blood pressure, and also gives you more energy in your cells, so you get more oxygenated blood, so you can do more physical exercise like cycling, running, and so on. And good for people who are like football and all that. They try to take that kind of juice, nitric oxide, beetroot juice, anarka juice. All these gives you more nitric oxide in the system to promote overall health.
Thank you.
How many people are still doing intermittent fasting? That's good question. Yeah, well done.
Yes.
Yes.
हम भी करते हैं, पर सपनों की दुनिया में करते हैं.
वो वर्क नहीं करता. सपनों में करेंगे तो वर्क नहीं करेगा.
नहीं करते हैं, हम कोशिश करते हैं, कभी होता नहीं है, मन मानता नहीं, क्या करें. मन पे कंट्रोल करना बहुत मुश्किल है.
मन को खाने में जाता है ना.
कल हम गए थे शॉप में, तो I bought the whole nut 150 grams again and I ate half already.
Oh goodness.
The intermittent fasting से भूख नहीं लगती.
बहुत फायदा होता है. Yes,
I don't get hungry.
16 hours, isn't it? 16 hours.
No, but it depends on how long. It don't need to be long. Even if you eat your dinner at 7 o'clock in the evening, and next morning you're having breakfast at 8, 9 o'clock, it's a 10, 12-hour fasting. Still is good,
Yeah,
good fasting. And they're quite simple because you're going to sleep anyway. Half the time, more than half time you're
Exactly.
sleeping.
Exactly.
So really, it's quite easy to do that. It's not a big deal.
Yeah.
The problem is these days I'm working late on the computer. So sometime 1 o'clock suddenly I feel pancakes, so I'll go in the kitchen and see what's there. Even sometime open up a bag of nuts, salted nuts with the coffee or things like that. You always kind of because I'm working a lot in computer these days, so that takes so that's why I'm gaining weight because I'm not walking too much now. Because I'm sitting down on the computer desk whole day and things like that, which is not good either.
श्रवण जी, आप पीनट्स खाते हैं ना? कभी
हाँ।
सोल्ट वाटर बगैर खाएं तो अच्छा है।
हाँ,
Salt
जानते नहीं,
मैं
जानते तो
salt-
है, मन है कि मानता नहीं, बिना
नहीं,
नमक वाला अच्छा नहीं लगता है।
मैं रोस्ट करती हूँ ना तो सॉल्ट नहीं डालती हूँ।
हाँ,
कैश्यू
नहीं,
नट,
नहीं।
आलमंड और वो पीनट्स किसी में सॉल्ट नहीं डालती
डालते
हूँ।
हैं। हम
ऐसे-
खाते हैं सनफ्लावर सीड खाते हैं, उसमें सॉल्ट भी डालते हैं, रोस्ट करके खाते हैं इसे, उसमें तेल तो
हम
अपना
नहीं-
बताना है।
बैग बड़ी लेती है।
और फुल मखाना खाते हैं, फुल मखाना को तो उसमें काला नमक डाल के, थोड़ा काला मिर्च डाल के खा लो। तो थोड़ा घी में भूज के तो खाने में अच्छा लगता है, स्वाद की तरह। उसमें कैल्शियम भी है, लॉट ऑफ डिफरेंट मिनरल्स। कोशिश तो करते हैं, पर प्रॉब्लम है कि काम
नहीं मानते हैं।
आदमी कितना काम करेगा। अब सोचता है कभी मन, मतलब हमारे चिया सीड है, कभी भिजाते हैं, कभी रात को बजाना भुला जाते हैं, तो बोलते हैं चलो तब कुछ और खा लेते हैं बैठ के कुछ करके।
Sarvanji, why do we have to soak the chia seeds? Can't we just
Yeah.
use?
I think you have to soak them. Soak them is better because that's when then you actually making like a jelly,
Okay.
It's like takmuria, yeah.
It's got no taste in it, it's like a very bland, but thing is got a lot of calcium, different mineral. Also, when it goes in the stomach, it swells up, so it makes you less hungry. You eat less food. That's the benefit of it.
Okay, because sometimes I put in the smoothie just like that, dry
Yeah,
one.
you can do that. But the thing is, it will soak up anyway. You can do that and you soak up inside your body. When it goes in your body, it'll swell up and make you look full, even if you're not.
Okay, thanks.
So then you eat less, kind of idea,
Yeah.
What is makhana good for?
Full makhana is maximum is very best, one of the best things for calcium.
Okay.
Usually वो होता है full makhana होता है बिहार में.
Yeah.
इन तालाब में होता है, पानी के तालाब में या कमल का फूल होता है, वहाँ पे फूल
Yeah.
निकालते हैं.
Yeah.
So usually what I would suggest is, if you like Swamiji does, you buy the flour, mix bajra, makai, singara kata, soya beans, all this into that 100 grams of each to make it like a mix of a different flour, and then make chapati. That will be much more healthier and nutrients for your body, and a lot of good fiber, give you calcium, magnesium, and all different minerals in the body as well.
I put ragi as well because
Ragi.
it's
Yeah,
got
that's what
fire.
I'm saying. You probably know more stuff than me. I'm kind of, I only go in the kitchen once a year, so I don't have that much knowledge,
Okay.
So Sravanji, you said omega-3, and so do we have to have a tablets or from the
No.
food?
All I'm saying is you can take the best place to get omega-3 for vegetarian people are flaxseed, and avocado, walnut, and almond, and these certain nuts have them as well.
So it's all from the food, yeah?
The problem is the omega-3 is very volatile. Any sunshine, that's why when you buy a flaxseed grounded from the health shop, it will come in aluminum foil. The sunlight can't go to it. Even oil, omega-3 oil will come in the black bottle to stop the daylight going into the bottle, so it can preserve the omega-3. Omega-3 is very good for your joint pain, things like that, every blood pressure, arthritis, you name it, for everything. It's like a WD-40 for your joint as well. It's cooking joint and things like that. So you have to take omega-3, but you take it naturally, food-wise is better. But if you can't, then you buy the capsule. But usually most of omega-3 is fish oil. If you're vegetarian, then you have to look at the vegetable type of it. You still can get them, but you have to be more careful when you're buying. Look at the label to make sure it's vegetarian oil. They made from flaxseed or something like that,
Can I say something? That's Elsie.
Thank you.
You can get, it's very cheap. You can get it from any shops.
That's right. It's not expensive.
And you dry roast it and
That's
then make a
exactly.
powder.
That's what I'm looking for. Usually what I do is I dry roast them, keep them in a jar. Just before eating, you take a couple of teaspoons and grind it and put that in your soup, your salad, whatever you're doing with it.
Or
Then you preserve the energy.
Or in your atta when you're making chapati.
That's it. Put atta, but all I'm saying is, but you don't grind it beforehand. If you grind it, then you lose the omega-3. Then it's no good to you. So just dry roast it and keep in the jar and just grind it before it. You know, just musli se thora पीस लिया, उसको आटा मिला दो, जो भी जैसे खाना है मतलब, no problem.
Is alsi the linseed?
Yeah, it's called linseed, flaxseed, alsi, it's all same thing. It's all same
Thing, name different.
It's like a cotton seed. That's what they are. हम लोग उसका तेल निकालते हैं तो उसका चारा बनता है, गाय को खिलाते हैं कि दूध अच्छा देगा। देहात में जब या असली अलसी का तेल निकालते हैं, तेल निकालने के बाद उसको हम जो बचता है गोबर की तरह वो हम लोग गाय लोगों को खिलाते हैं कि गाय को दूध अच्छा देता है।
Okay, yeah. I have heard that this lotus seeds, it's quite good for reducing blood pressure. Lotus seeds.
Lotus, I don't know. I can find that out. Yeah, you might be right. I'm not questioning you. Yeah, that's fair enough. Good comment.
That's full makana.
That is called makana, fox seed.
Yeah, it's I think kamal ka seed, kamal flower seed.
But that's makhana, isn't it? That's full makhana. Kamal ka seed.
Yeah, I think that is seed, but then you just if you roast it, it becomes makhana, something like that.
No, they comes in the skin. You take the skin off and that's the full makhana inside. Okay. On the top, there's a hard layer of black skin which you take off.
Yeah,
and that's what you buy in the shop, all clear. So you get the full makhana. You just roast it and you eat it like that. That's it. There, lady showing it. So Sakur is showing it there. Full makhana. See, that's excellent. Well done. See, we all prepare.
Because I do take.
Thank you, Ji.
Full makana.
You know, there is a ready-made oil you get at 369 in the health store, which I get that omega 369.
Yeah, but they come in aluminum foil. Then you have to make sure they seal properly.
Oil comes in a dark bottle.
A dark bottle, that's what I'm saying to you. That's why I said to you, oil comes in dark bottle and also comes in
369 together.
Yeah, that's okay. That's fair enough.
So, yeah.
All I'm saying to you, see, one thing I'll tell you, it's very, for body, if you don't want liver to overwork, you have to take everything in fruit and vegetable and mineral in natural form. Once you take any kind of chemical, they come in certain form chemically. The body, liver need to convert that into ionic form before body will absorb it. So liver's got other task to do. So you give him more task, then he can't do the task he's supposed to be doing, and he's doing things he shouldn't be doing. So that's why you have liver problem, fatty liver, sluggish liver, and that's why you have a lot of gas, bloated feeling is because you don't digest the food properly and it takes longer. You see the problem. So really, that's why in Ayurveda or in our culture, remember we do fasting once every 15 days. Ekasi ka vrat karte na hai. Kyun karte hai? To give the body the rest. आपके liver को, heart को, lung को, सबको, so digestive process take complete break. पर हम लोग तो वो भी खत्म कर दिए. जो एकादशी में खाना देखते हैं तो हम लोग के खाना से अच्छा रहता है. There's a lot of chips, a lot of everything fried and things like that. So really, that's not good either. But that's why intermittent fasting is much simpler and much easier to do. And obviously, lifestyle is very difficult here. You have to, husband and wife both need to work to sustain your lifestyle. And sometimes you're busy working from morning right to the night time before you go to bed. And it really hats off to all the females. They work harder and they look after the family. They are the pillar of the family. After every successful person, there's a female behind as well. Female nahi hai to aadmi kabhi successful hota hi nahi hai. That's the fact of life. And I think this is a good way to finish the class off on today's lesson. Is that good enough?
Thank you very much,
Thank you. Thank you, everybody.
Thank you.
Thank you very much, Sarvanji.
Yeah, thank you, Basaji.
Really good information.
Thank you very much.
Yeah.
Always, as always, very good.
Thank you very much. Look after yourself and take care. And the June 21st of June, there is a what do you call it, International Yoga Day as well. So we'll see what's happening with that. On 20th, the PYPT doing the function. So I can send you the link on the WhatsApp group Yoga with Sam. You can connect with it, no problem. Or you can watch in the Facebook as well. Okay, take care. Om.
Thank you.
Good night, everybody. Take care.
Good night.